things we do in the hospital that may not always make sense to people. Why do they keep moving me from room to room? When someone is first admitted to the hospital, they are assigned a room or a floor based both on what type of illness they have as well as how sick they are. Obviously, the sickest of the sick will end up in the ICU. As their condition improves, they may get moved to what's called a step-down unit where they are still closely monitored, but not as much as in the ICU. And if they still need to be in the hospital, but they're continuing to improve, then they might get moved to a regular med-surg floor. Some hospitals will have specialized floors, so they may have a particular floor for oncology patients, for patients who are being treated for cancer, and they may have a particular floor for patients undergoing surgery for orthopedic issues. But let's say you are being treated for cancer as an outpatient and then you develop pneumonia, you may initially be admitted to a medical floor, a regular medical floor, and then as that improves, then you may be moved to the oncology floor. Next, sometimes patients are moved either because they or their roommate may have a infection that is contagious, that is communicable. So let's say you have a COVID-19 infection, they will usually either give you a room by yourself or they will room you with another patient with COVID-19. Now, let's say you were admitted to the hospital for a non-infectious problem and then your roommate develops what's called C. diff, which is an infectious type of colon infection. They will either move you or your roommate to a different room to separate you. Sometimes, however, it's just a matter of room availability. Which rooms are available, who can be roomed with whom, and sometimes that means shuffling people around a little bit. So please be patient as you get moved around from room to room. We know it's inconvenient and sometimes can be uncomfortable, but it has to be done so that we can accommodate everybody who needs to be in the hospital and give them the best care they need on the appropriate floor.